are some who dare to care.
I know that the patients come in, they're uncomfortable, they're scared, they're frightened, and I want them to see a person who's happy to be where I'm at, and I want to feel comfortable with me as their caregiver. Okay, how you feeling? You okay? Comfortable? You need another blanket or anything?
Patients all come in extremely panicked before the operation, especially some of the operations that I do. You know, it's a purely elective operation that they're going for, and she puts them at ease as soon as they, she sees them and smiles at them, and I think that helps them a lot.
Nursing was tough, just book-wise. It was hard in school. But in regard to when I got on the floor, now that was a different story. When I started speaking to the patients, when I started to interact with them, I found that I had a gift of communication. I felt comfortable enough to try to tell them, this is what I'm here for, I'm here to care for you. And I was able to achieve that.
She excites us, she inspires us, she makes us dance, she makes us smile, she makes us have a good time, and that's what you have to do on a daily basis.
Being a patient myself, knowing how nervous you are going into surgery, Josephine is one of those nurses that our employees ask for her to be their nurse.
And as a patient, when I came for my total knee replacement, she's so loving and caring. So I requested her to be my circulating nurse, and she immediately willing to do it.
Dr. Tabije is an anesthesiologist here at our hospital, and I don't personally work with her on a regular basis. She usually works upstairs in AMSurg, ambulatory surgery. And I was doing a case with her one time, and it was a laparoscopic case, so the lights are dark, and she said, "Josephine, come here." I said, "Okay, what's going on, Doc? Is everything okay? You need me to get something?" She says, "No, I'm having surgery next Thursday. Are you here?" She says, "Well, I want you anyway." She wants me to be in the case with her. I felt very honored, that one of the anesthesiologists would ask me to be her personal nurse. That's a great honor.
That joy for living that she has, and her attitude toward the day. The OR is a very busy place. Can be a very stressful environment, and she sails through the day and eases everybody's stresses, the patients too. If I was having surgery, I would love to have Josephine be there in the operating room with me, especially right before I went to sleep.
I'm very proud of being a nurse, being able to have the knowledge, the skill to help people, and especially in the operating room, where it's very technological. And yes, my patients are under anesthesia during most of the procedure, but for that first initial encounter, I can bring, a little humor, a little, maybe sometimes a song. We're just waiting for the surgeon to come in, but since we're waiting, I was thinking maybe I could sing your little song. Is that all right? Okay. I peer through windows, watch life go by. You want to also try to reach out and touch their soul in a sense. Not so in depth, but in a sense where you can really make a connection and help them to know that you're really there to care. Because that's what we're all here for. And if I can inspire other nurses to come out of themselves and remember that we're not just doing a job, we're dealing and treating people. My heart would take wing and I'd feel so alive.
I think that there's something within all nurses that makes us people persons, people nurses. And I think that the same is true for Josie. She uses her voice to motivate, to inspire, and to make other people enjoy.
I think I make a difference with my nursing, with my little talent of singing. It makes the patient feel more special, that I can share this. Just hearing a nice voice, a calming song, it affects my nursing practice. It affects my patients, in a good way. And that's something that I would be proud of. And I hope it would inspire other nurses to do the same. If it's not singing, something else, to help connect with our patients, to give better patient care, and to show that we, as the nurses, care.
There are some who dare